Welcome everyone. This is now the third HWISE-NOW virtual coffee hour. So we're so happy to have you here and that you took the time to join us today. We've had a good response to this invitation, and I see a lot of HWISE folks, a lot of familiar, not faces, but names in the attendee box, as well as some new people or people that I haven't had the pleasure to meet yet. So for any of you that might be new to HWISE, I'd like to introduce myself first. I am Melissa Beresford, and I'm an assistant professor in the Department of Anthropology at San Jose State University. I'm also a steering committee member of the Household Water Insecurity Experiences, or HWISE, Research Coordination Network. So for anyone who might be unfamiliar, HWISE is a collaboration that's been ongoing for many years now. With the financial support of the National Science Foundation, we have built a community of practice in which we're fostering key analytics and theoretical advances to examine and understand the causes and outcomes of water insecurity at the household scale. So my own research as an economic anthropologist examines how people create and mobilize informal economic institutions in response to water and other resource insecurities. I've done quite a bit of research on water sharing and informal water vending, both as they relate to water insecurity. And this research has largely been in collaboration with HWISE colleagues. That research has also mostly focused on what we might call the Global South. But I'm currently in the midst of launching a new project that will examine responses to water insecurity in the global north. My own research largely based in California and the broader San Francisco Bay Area region. And this new research is also in collaboration with HWISE colleagues and part of a larger HWISE initiative that examines the causes and consequences of household water insecurity in the global north. So this brings us to the topic of today's panel, which is homelessness and water insecurity. A group of HWISE scholars led by Dr. Katie Meehan, who is here today, published an article a little less than a year ago now that confronts the persistent myths that household water insecurity is somehow an issue that does not affect people in wealthy nations. This article built off of Dr. Meehan's Plumbing Poverty Project, which illuminates geographies of unequal plumbing access in the United States. In this work, Dr. Meehan and her colleagues showed that precarious housing conditions is one of the strongest predictors of water insecurity in the US. Of course, we know that this issue is not unique to the United States, but rather is likely a growing trend across many of the extremely wealthy, but extremely unequal economies around the world today. So the causes and consequences of housing insecurity and homelessness are, of course, diverse and complex, just as the causes and consequences of water insecurity. So today we've convened 4 incredible early career scholars who are actively working on issues at the intersection of homelessness and water insecurity. So my goal today as moderator is to facilitate a discussion among them so that we can start to map the contours of the existing research on this topic and lay out important directions for future scholarship and policy work in the coming years. So before we begin with that, I just want to mention some logistics. We'll be recording the event. The event is recording right now, and we'll be hosting it on our HWISE YouTube channel after the talk. We are in webinar format, as I mentioned, so that means that participants won't be able to turn on their mics or their cameras. You're just going to view the panelists. But as we talk, please feel free to type your questions or comments into the chat box, the Q&A box, and we will get to those. So first, we're going to do introductions of the panelists, followed by 4 very broad prompts that I have prepared to guide our conversation. For each prompt, my goal is to allocate about 10 to 15 minutes of discussion among our panelists, followed by about 5 minutes of Q&A from the audience. So again, as you have questions, please type those into the chat box, and then we'll get to those kind of in that 5 to 10 minutes after each prompt. So we have, typically these sessions are about an hour, but then we probably will go longer, normally about to the hour-and-a-half mark. So of course, feel free to log off anytime that you need to, but likely the conversation will go for about 90 minutes. And then even after that, if you'd like to stay in touch after our session is over, please stay to chat a little bit longer, or you can shoot me an email. We, all of the panelists, and I really see this as the beginning of a conversation. And so we want to keep in touch with all of you who are interested in continuing to talk about this or work on the topic. And finally, I'd just like to say that for any members of the audience who would like to learn more or join the HWISE community of practice, you can visit HWISE, that's HWISE-RCN.org to learn more. So now let's begin. So I'd like to start with introductions. Our panelists today are Marianne Odatola from King's College, London, Lourdes Johanna Avelar Portillo from USC, Fausto Amador from CIDE, Mexico, and Anna van de Grift from Texas A&M University. So I've asked each panelist to first introduce themselves and explain how their own work and research is oriented towards issues of homelessness and water insecurity. And after they go around and introduce themselves, I'll start with the first question. So let's go ahead and start. Anna, do you want to go ahead and start us off?
Thank you for the great introduction. I am so pleased to be here and to meet other people involved in this topic that I have a lot of passion for. So it's exciting to meet you all. Thank you. Yes, my name's Anna Vandy Grift. I am a geographer at Texas A&M. I'm also a recently minted PhD candidate as of last week. So I have yet to enter the field, so that may limit may limit a little bit of what I have to offer you today, but I'm excited to be part of this conversation. I will start research in Seattle, Washington this summer and look at multidimensional experiences of water insecurity, of homelessness, as well as urban policies and the service providers that contribute to sociospatial dimensions that increase or reduce water insecurity as WASH insecurity, so water and sanitation. And I draw from both global North water security and urban design literatures, as well as personal experience, to think through WASH insecurity of homelessness as more than a question of infrastructure, but also where provision of publicly accessible WASH is tied up with notions of belonging and social control of public space. I am approaching this research from the perspective that provision and access to WASH is a shared issue for both the broad public and for people experiencing homelessness, because I want it to be understood as impacting city livability for all people and unhoused residents' capacity to carry out everyday activities with dignity. I will be specifically looking at the built environment, the barriers that people are confronted with as unhoused residents in Seattle, as well as city ordinances and rules and regulations that homeless service providers may inadvertently produce that are barriers to WASH. And I will also look at stakeholder perspectives and how that is influential in city responses to homelessness and WASH in combination. And experiences as well. I think I need to understand how people use coping and emotional experiences and how this impacts relationships and the sorts of relationships that people engage in order to access WASH. Thank you.
Thank you so much. Marianne, would you like to go next?
Yes, hello everyone. My name is Marianne Odatola and I'm a final year geography student at King's College London. So I'm also yet to enter the field. I have a broad interest in environmental justice, and this actually led me to begin working with Dr. Katie Meehan as a research assistant, looking at homelessness and water insecurity in London. We started this project last year, but unfortunately due to the pandemic, a lot of our research was put on hold. We are hoping to start picking things up again, but we did a lot of preliminary research, and I hope to be able to share some of our findings today.
Wonderful. We really look forward to hearing about that. All right, Fausto.
Hey, hello and good morning or good night to the people who are with us. I think that Anna said for us everything we want to say and our interest, and thank you for that. But my name is Fausto Amador. I'm 20 years old. I'm an economist from the university, from Chapingo Autonomous University. I'm currently about to finish my master's degree in methods for the analysis of public policies at the city, which translates as the Center for Economic Research and Teaching. It is one of the most important centers for the study of social science, not only in Mexico, but in the rest of Latin America. Um, I also have experience in some modern institution in which I have taken some trainings, workshop, and courses such as the Complutense University of Madrid, the Food and Agriculture Organization in Rome, and the OECD in Paris, as well as assistants, legislators in my country, and carried out some consulting work. Right now, my current line of research is homelessness, limited to the homeless young people who go through this phenomenon or who are at risk of. And I think that's all.
Wonderful. Thank you so much. And Johanna.
Hi, everyone. So I'm Johanna, and I'm a fifth year PhD candidate from USC. And so for the past 5 years, I'm working on this topic that kind of explores using mixed methodologies, the way people who are unhoused or experiencing homelessness navigate spaces and places that, may not provide them the safe, equitable, and affordable access to WASH services. And so my focus centers specifically on the community of Skid Row in downtown LA. And I'm conducting surveys and in 2019, so this was pre-pandemic. And so the landscape of WASH insecurity has completely changed as a result of the pandemic, but I'm being in communication with service providers as well to kind of measure how that has changed and impacted the community as a whole. But I focus predominantly on the point of view of people with lived experience and kind of understand how they navigate those spaces that don't provide basic necessities to survive on a day-to-day basis. So I'm really excited to share with you some of the findings as I'm writing this dissertation. So thank you for being here and being part of the conversation.
Wonderful. Thank you so much. So I have, oh, that's my computer telling me to update. Sorry. I have prepared 4 very broad prompts. So the prompts, like I said, are very broad to kind of get the conversation going. And I'm hoping that, people can just jump in and have a discussion among panelists, drawing lots from your research and experiences. So the first question that I have for you all is, what do we as water insecurity scholars already know about the intersection of water insecurity and homelessness or housing insecurity? And particularly this, I want to know particularly as it applies to high income economies. So would anybody like to start out with that?
I can start. So this is really a fairly new kind of focus on WASH insecurity. And if you do a quick Google search, you'll see that there's only a few scholars that have kind of started kind of digging deep into the experiences of people who are unhoused. Because the common misconception is that WASH insecurity doesn't exist in wealthy nations, right? And we have seen that in the work of Dr. Meehan, Dr. Jepson, Dr. Pierce, that kind of contests that misconception. And so for the scholars that have focused on homelessness, I mean, we have seen in Arizona with the work of Myers and Dr. Wittig that try to explore through the different living conditions that people are living, either in shelter systems, either without a roof or in tents. They kind of have different levels of barriers in accessing wash services. I have read work in Boston where they explore how, as a result of wash insecurity, I mean, it results to poor hygiene practices, and that increases their health risks, specifically to skin infections, to a very vulnerable population that's already coping with chronic illnesses on a daily basis. And in San Diego, I have read work that explores how people, to avoid criminal justice systems, they tend to live in very precarious, very unsafe places, where it kind of puts them at a distance from accessing services, and that's including wash services. And so it creates even added health barriers to a population that's very vulnerable. And so we know that wash insecurity exists and is heavily experienced by the population, that there's no consistent access in the communities. And so it's more of like digging deep of how do we increase access to the services, because it's a very contested topic. And we can talk about that later in the discussion.
Yeah, I think just to add on to what Johanna said, especially in the UK, this issue isn't very well understood at all. And water insecurity, especially, is kind of framed as something that's physical. So there's a lot of conversation around physical water scarcity or shortages due to climate change, for example, but the gap between homelessness and water insecurity as a whole isn't well understood at all, perhaps only by those on the ground, the homeless, or those working with people who are unhoused. So I think, especially when Dr. Katie Meehan came to me with this project, I was myself quite shocked to understand and learn that these are very real challenges that the homeless population experience. And I think that part of this is because a lot of access to public water infrastructure has been limited. So, for example, in London, you see that public parks or public toilets are closed after a certain time to protect certain vulnerable groups, such as women. But then this then places a strain on the unhoused community. And then we also see in certain boroughs, such as Westminster, which is London's most affluent borough, homelessness has been criminalised in this space. So the homeless are not allowed to stay in this borough. They're actually pushed out by the police or other law enforcement agencies. However, Westminster is also one of London's only 24-hour boroughs. So if they were to access water infrastructure, maybe through chain restaurants, this would be where they could. But because they are no longer allowed to reside in these spaces, access has become very difficult and limited to them. And I guess it ties into the whole commercialization of wash access as well, because we also see that in some parks now they are implementing a system where you have to actually pay to use the toilets. And Dr. Katie Meehan actually pointed out to me that in one of the parks, Greenwich Park is very famous over here, not only is it a case that you need to pay to access the toilet, but it's also the payment requires a card, so you can't actually pay using cash. And this is obviously a problem for the homeless community, who probably will rely on physical money. So all of these things that maybe do serve a purpose in protecting certain vulnerable groups are having a negative impact on the homeless community. And I guess it all links back to the fact that this problem, the link between homelessness and water insecurity, is just not well understood by policymakers and those with decision-making power.
I just want to say that, as Marianne and Johanna mentioned, the homeless are at a disproportionate risk of vulnerability from hygiene problems, dehydration, and heat-related illness. as they spend much more time outdoors and many have limited access to an adequate amount of water from acceptable quality. Insufficient access to water can occur in rich, highly developed countries that have a well-developed water infrastructure and water treatment systems, such as Canada, United States, United Kingdom, and others. Now, the important thing for me, the thing comes from thinking that homelessness is a multicultural phenomenon and that it affects these vulnerabilities not the same for people at risk or homelessness or those who are already living without a roof or shelters or encampments, which is an even more curious phenomenon that encampments or communities that are formed because it is more likely that this is seen in high income countries that in developing economies in which the behavior of alienation, stigma, and shame doesn't allow the cooperation in search of solving needs such as those related to water insecurity.
Yes, I think there's very little to be found at this point in the body of literature. I dug deep. So I started looking at legal scholarship and urban design scholarship and history even over WASH provision in the global north, and found this very interesting trajectory of built up infrastructure during the 19th century, and that infrastructure being an emblem of civic pride and a draw to cities, and a sense that this was about equality, a bellwether of equality for people to be part of city life and urban life. And then when we see the deterioration and austerity policies and things like that, that we end up with this gaps in provision. And so to me, the work from Marianne et al. On that sort of busting open the myth of universal provision helps me think about how experiences are assumed to be secure. We're assumed to have all access to water, and that's not true, and that people are equally housed. And also this other aspect, which I'm really interested in, this dynamic, private WASH versus public WASH. So now we have from urban design, they point out that really this has been disappearing from urban spaces. The infrastructure is gone, there's less toilets, they're less likely to be replaced. And that leaves people that are experiencing homelessness in this extra burden of less public or private resources. And I think that there's parallels that can be drawn to the broader public to show that there's overlapping concerns. If you have a disability or small children and you're traveling, what are you going to do in urban spaces where it's a toilet desert? Or you're a runner and you want to run, but your mobility is influenced by the fact that you can't go very far without knowing there's a toilet available to you. Or transit users and ride hailing workers as well. So I'm kind of trying to think about this as, how do we embed homelessness within a public issue as well? Because people need to not see it as only an isolated niche problem. It's not just those people over there, it's part of your community.
Yeah. Sorry, go ahead, Marianne.
Oh, sorry, I just wanted to say that, yeah, I think that was a very good point, Anna. And I'm not sure if, well, I'm sure it is probably the same for you guys in the US, but especially in London, these themes became a lot more prominent because of the pandemic. There was a big push on people being able to wash their hands and sanitize, and then all of a sudden it's as if everyone realized that there's this whole community of people who can't do this because they don't have access to. And what was interesting in the UK was that during the first lockdown we had, which was from March last year to about June, the unhoused community were given accommodation, so they were able to make use of the empty hotels or the empty businesses, and then things kind of opened up again, so they were kind of left to their own devices. And since then, during the second and third and how nth number of lockdowns we're on now, it seems that the unhoused community haven't been catered for in that way. So even despite knowing that this is a group of people who are very vulnerable, and the fact that, you know, provisions can be made because they were able to during the first lockdown, again, they've just kind of been left to their own devices now. And yes, it's a shame, really.
Wonderful. Thank you so much. Yeah, I also just wanted to add that as somebody living in the San Francisco Bay Area, obviously homelessness and wash insecurity it's not a new issue by any means. It's been around for a very long time. But the housing crisis in the US, I mean, across the country, but in the Bay Area, it's just insane, the cost of living. And so it's just increasing even more so with the number of people that simply cannot afford housing. And so I think that that is something that maybe hasn't been paid attention to as much in the literature, or is there implicitly, is the kind of like increasing, I mean, it's always been urgent, but it's becoming even more urgent as well. So thank you all. So do we have questions or comments from attendees right now on this topic? Other people who are working on these issues, who have perspectives to share or questions for the panelists? I'd like to spend some time doing that before we move on to the next prompt. And you can just type them into either the chat or the Q&A. I don't see any right now. Anybody? It is something in terms of the question of what we know, based on, you know, I think a lot of what we know is based on experiences that we all have in our research and daily lives. But as you all explained, the literature is quite sparse on it in terms of the peer review literature, or it's quite scattered and very different literatures all over the place, as opposed to one kind of coherent conversation through the literature. All right, I'm not seeing any questions or comments, which is fine. We can move on. Oh, yeah, Katie Meehan says, I think that some of this is driven by the WASH industry of scholarship, which is explicitly focused on global South countries. And I think that that's a very, as Johanna, I think Johanna said, a couple of you had mentioned that that was kind of one of the big contributions of that HWISE in the Global North article, was kind of busting these myths that water insecurity is something that is experienced in the Global North. Yeah, and an interventionist policy and practice paradigm. Absolutely. All right. Any other comments, questions? Okay. All right, so I'll move on to the second prompt. And of course, if attendees have kind of questions that come up on this prompt later, we can always go back. This is informal, so don't feel as though because we're moving on to the next prompt that you can't make any comments or questions. Oh, Wendy has a question. What methods have been used to study this topic in the literature? I think that's a really great question. What are the kind of primary methods that are in the literature? Do any of the panelists want to answer that?
For personal studies, or like the literature, the existing published literature? For the articles I have found, if it's for the existing literature, that's a fantastic question, and I think that's some of the arguments that I make too on my dissertation. So of the articles I have read, majority of the focus tends to center on either qualitative work that centers on conversations with service providers, but there's not that much work that centers on the voices of those with lived expertise of homelessness. And so as we move forward, we need to include people with lived expertise into the conversation and kind of engage them on part of the research process, because they're the ones with the knowledge, they're the ones experiencing this phenomenon. And there have been studies that do survey data on lived experience, but I have only found 2, I think, and majority of those were in the East Coast. That I have found, but the majority is very qualitative data and center on very small sample size with either service providers or a few people with lived experience. And I mean, this is not to say that doing research on this very, very vulnerable population is easy, because it's not. You know, as my own experiences myself, like it's been really hard. And so I think this is something that as researchers we should think about too, like how do we provide very comprehensive research on a very vulnerable population without making it unsafe for the researcher, but also kind of stigmatizing the population as well. And so I would say, to kind of summarize the answer, would be very mixed methods, but it tends to be very qualitative from my experience of the research I have read on very small sample size interviews.
And okay, and Fausto added, I would like to compliment the qualitative methods. Do you want to talk about that right now, Fausto?
I don't have a lot to say about that. I just want to write about answer the question right now. No.
Okay. All right, so yeah, people can read Fausto's response there, talking about ethnography and hermeneutics, and yeah, and some quantitative methods, experimental data collection, even longitudinal analyses. All right, so Samir says, to what extent do different forms or uses of water factor into water security assessments in the homelessness context? For example, we may not often think about air conditioning, an indirect use of water, or as important for mitigating the impacts of heat waves in urban spaces. That's a really great question. Would anybody like to tackle that one? In my own experiences, I feel like I see a lot of the homelessness water insecurity assessments, like they are focusing on WASH, but oftentimes, I mean, don't necessarily focus on like drinking water too. So kind of what are different types of water that are factored into these assessments, or different types of water that are maybe left out of these assessments? Does anybody have a comment on that?
I think in general, these need to be very explicit questions, because one, talking about sanitation and hygiene has a kind of taboo around it, even in the global north. And so when service providers or anyone's talking about this stuff, it's like, oh, we have facilities. We don't know what those facilities really are explicitly and how functional they are. And if there's soap, is there hot water? So something like this, like definitely being able to avoid heat illness is important. And so, yeah, asking, I think, lived experience methodologies that can get at lived experience. People know they're the experts. So we need to be able to ask maybe service providers what they provide and what they understand as a service, and then also ask people the kinds of needs and things that they're accessing within their contexts.
And I'll just add that Christine Demeyers and Chloe Warpinski, Demeyers, Warpinski, Wooditch, Amber Wooditch too. There's an article, 2017 article on homelessness and water insecurity in urban Phoenix that talks about the heat mitigation uses of water, which is a really good article to check out. And then there's Palta, Dubray, Wooditch, there might be another author on there that I believe is in Human Ecology, talks about also some of the heat impacts of homelessness from like an ecosystem services perspective. Just responding to your question about the air conditioning and kind of indirect uses of water. So those are a couple of articles that get at that. Raul says, I think the biggest challenge is the study of extraordinarily marginalized and vulnerable populations in a manner that does not become extractive. For researchers, the work becomes a publication, but for these individuals, what do they get out of this type of work? This is where researchers have an extremely important job. And the question becomes, should we even conduct research on water insecurity and homelessness that only derives in a publication rather than in actual real policy interventions that mitigate harm to these extremely vulnerable populations? That's an incredible, such an important question. So would anybody like to respond?
I'm still an undergraduate student, so I don't have much experience with this, but I gather that this is a problem throughout academia, to be honest. And while I know certainly that my work with Dr. Katie Meehan, we hope it would go on to inform policy, and we hope that those with decision-making power will use the research that we produce to inform their policies going forward. It's just something that unfortunately we can't guarantee because we're not the ones in the decision-making seat. But we do hope to create white papers and policy briefs so that the information can be shared with those in a position to be able to do something with our findings. But yeah, I think that is a very good point, and I'm just not sure what we can do about that, unfortunately. If someone else on the panel wants to add anything on.
Can I just say that's a really great question, and that's something that I struggle myself. And Marianne, I agree, this is a problem with academia as a whole. How do we make our research actionable and not just in the shelves of academia? And one, I think that has to do with funding. I kid you not, I applied to funding for this project that I did for the past few years, and it's so hard to get this type of project funded and for people to care. Because one, when we think of homelessness and watch insecurity, it doesn't really affect them. So it's like really hard to find projects that kind of we're looking towards benefits for the community, not on very individualistic benefits. And that's really hard in the US. But two, I think that's something that for Anna, Marianne, and Fausto, when they engage in their field work and start conducting this work, is to think about forming those networks with service providers who have connections with populations with lived experience. And like for my own work, and I'm going to speak on my own experiences, I mean interviewing service providers and with the intention that I can provide these findings to them and help them get grants that they need to continue their services. And that's one way that I'm trying to find ways to translate this into more actionable solutions, because if I help the service providers through providing things like mobile showers, laundry services that are mobile, or I know in Skid Row there's this very contested program called the Refresh Spot, and they provide, well, it used to be 24 hours, but with the pandemic they reduced their hours. And they provide access to all forms of wash access, from laundry services to fountains, restrooms, and showers at free cost. And that's really hard to see, especially in LA, for the city and the county to fund those type of programs, because a lot of the backlash that people get, it's this really expensive, and the housing should be the only solution. And so partnering with those nonprofits would be ideal, and kind of shifting that narrative and making that more actionable academia research. And because, as a matter of fact, it's very hard when you're interviewing a person with lived experience and they only probably get a gift card or a meal card or you know, whatever compensation, and then you don't see them ever again. And that's really hard to do, that type of research for, like, how do you help them? And aside from partnering with the nonprofits, I would advise to also focus on policy papers that kind of provide concrete solutions that people tend to overlook. Because, and I know I'm getting ahead in the conversation, but the contested problem I get, even in my own research, is that providing WASH services which sustain homelessness enables it. And it's just too expensive. Instead, we should be focusing on housing. And that we missed the point of, like, housing is not only the part of the solution. In the interim, as people qualify for housing, are connected to housing services, what are the interim solutions we should be providing? Because the influx of people that are housed and exiting homelessness or entering homelessness, it's very, I mean, that there's more people entering homelessness than exiting homelessness. And so we need to be focusing on very immediate solutions. And I think WASH services is one of them. And so kind of writing those policy papers and connecting with service providers to kind of make that more actionable solution research.
Can I talk? Yeah, okay.
Yes, of course.
Regarding what Professor Raul said, who is my thesis advisor, and I feel that the question is direct toward this side, is that we have had this discussion on ethical issues, and the answer is still a very, very fine line that can put us in a dilemma. I can talk about I can talk much about water, but I can say that for the research to become applicable and effective public policies, it is important to talk about several elements about the social political conformation of the country. Currently, for my dissertation, I'm based on what Snyder and Ingram proposes as the construction of social identity, be it positive or negative, and whose impact resides in the construction of deserving or marginalized and punished populations. It will also seem important to me to identify the actors involved in the public problem of homeless people in order to use frameworks as important as the, I don't know, the advocacy coalition framework, since I can assure that the role of the state is several times different in developing countries than in high income countries, or for example, the PET, the punctuated equilibrium theory, from which we could take the idea that an event as disruptive as the current pandemic and frame it in a global context of water stress, it is possible to make a radical change in the public agenda.
Yeah. Oh, sorry, Anna. I don't want to cut you off.
Oh, just a small comment. I think that Johanna has the right idea that we need to definitely build alliances within communities and think in that collaborative research framing as much as possible. I think also homeless advocates have a lot of experience about how to frame issues and how to maintain attention from the public. They really, have savviness about that, that we can learn from and maybe be of use within that space for them as well. And I think from my experience working in Peru is that you have to build relationships incrementally and as much as possible preserve that sense that there is consensual space as much as you can and an even power structure. But those are my comments.
Wonderful, thank you. So just rounding out discussion on this, Ellis has a comment saying Raul raises a very important point about that also applies to many other vulnerable groups, including refugees, etc. Part of it has to do with how universities are obsessed with counting the beans. In Atlanta, there was a group from Georgia Tech that studied water insecurity among homeless populations strictly by observation. They were observing things like scramble for half-used water bottles, etc. I think that we should really think about creative methods that will not be extractive, and I will be happy to hear other thoughts. So I think that, you know, a lot of you just commented to that. Ellis, I know you had your hand raised. Were you able to ask, was that the question that you had? I see your hand is raised right now. I just wanted to make sure that you had the opportunity. Okay, great. And then Raul followed up saying, I've done some work on toilet insecurity and homeless populations in Vancouver, which is one of the reasons I'm keen to highlight what these challenges of an engaged research project involve. So just some other comments from attendees. Anybody, any other thoughts on this? I think okay. So a very excellent follow-up question to this is, the unhoused are a heterogeneous population. This is from Wendy. Youth, gender diversity, mental health diversity, etc. How can researchers ethically engage, support, but also recognize this diversity? Any thoughts on that? And Wendy says, maybe that work is ahead of us. I think it is a very challenging question. And this is me personally, I think that a lot of you all on the panel here, you know, started to get at that, you know, informing those collaborations with different organizations that are committed to different, many of those organizations are committed to different, you know, populations within the homeless population as a whole. So I think those partnerships are really important. And also just add from a personal level that I think all of you brought up really important points from collaborations with local organizations, local partners, writing policy papers and doing work, as Raul said, is it ethical for us to just publish and peer review, normally behind paywall peer review journals? And I think that, Johanna, you're so right in saying that we need to be reaching out into the policy space. And this is, I think, such an important point. And I think that's where HWISE as a network really can help to move this forward, to help get a critical mass of scholars and also collaborating partners together that can help move those conversations forward as a collective, as opposed to any, you know, individual that's doing it. It's, I think, much harder to have influence as an individual scholar, but when you have networks of scholars and practitioners and collaborators all together, you can start to get a more critical mass to be pushing those spaces. Raul says there's another level of analysis, which is part of Fausto's thesis. There are individuals who experience homelessness, those who are chronically unhoused, and those who exit and enter the condition. This group is the group focused on Fausto's work, and I see Johanna nodding as well. Would anybody like to talk about that?
Just about what Professor Rose said. I'm in the process. I'm in the process of my dissertation, so I can talk a lot. I'm going to do some in-depth interviews. So I can talk a lot about the results. It's just the design, but yeah, that's all what I can say right now, because I'm in the process of.
I think to I'm gonna answer that question in a minute, but to go back to Dr. Jepson's question on heterogeneous groups, I think when we study very marginalized populations, we should be very mindful of, just because people are experiencing homelessness doesn't mean that the level of experience is the same throughout everyone who is unhoused. You know, in my work right now, I'm trying to analyze how there's gender identity differences that exist within groups in accessing WASH services. There is sexual orientation differences. Age is a huge factor. You know, there's a very growing elderly population, at least in LA, who's very vulnerable in entering homelessness. And you know, and also prolongation of homelessness. And so taking into consideration these factors is really important when doing this research, because there's not a one solution that fits all. We need to be very mindful of the type of solutions that we try to advocate and outline in this research, because women experience a lot of violence on the streets. People that I interview, even though my models don't show any differences in gender and sexual orientation, they're very visible in the communities. And so statistics may not only solve our problems, but, you know, and that's really important with mixed methodologies in interviewing the community, kind of understanding their experiences, because differences in access exist, and we need to be very mindful of that. And for in shelter versus someone who's exiting homelessness, those are also very important. Kind of measuring the living situation of a person, because people who live in shelter systems may have very different experiences than people who live in tents, makeshifts, without a roof, in vehicles. And examining those forms of living situations is really important too, because at least for people who live in shelter systems, in the day or nighttime, they may have access to a restroom or to a shower, but people who live in tents or makeshifts or vehicles, they don't. And so they have to engage in very inhumane coping mechanisms, like using a plastic bottle or a bucket, or on the sidewalk or on the streets. And in addition to that, people get criminalized for those type of behaviors. And so and that even puts a greater obstacle in people getting criminalized, not qualified for housing. And so there's like so many problems in kind of addressing the needs and addressing the homelessness.
I think also, just to add a small comment to the question that Dr. Jepson posed as well, alongside working with the charity partners, I think it's also important to look at some of the information that already exists online. So I'm not sure if this is the case in the US, but in the UK and London especially, the really big charities actually produce annual reports where they give a breakdown of the homeless population. So which percentage of the population are men, which age bracket make up a large proportion of the homeless population, and then maybe also what kind of challenges the homeless population are most likely to be dealing with. So again, a lot of this information that the charity partners are giving us enable us to engage and support and recognize the diversity within the homeless population.
Wonderful, thank you. This conversation has been so great. We've actually, in a roundabout way, I've let things, you know, kind of be informal. We've gotten to a lot of the questions that I had on my list already. One of the questions that I had is, what were the key pitfalls that scholars need to be aware of? Key pitfalls or concerns that scholars need to be aware of in conducting this research. And so I think that these ethical issues that people are raising are really important, as well as the research gaps that are there. Okay, we have a couple other comments. Cassie Workman says, I'm wondering, is there a stigma whereby folks who do not experience chronic homelessness may not identify as homeless and may not be recognized as housing WASH insecure? I'm reminded of a story of a student who told her friend who was evicted and was sleeping in her car and using her friend's showers so that she didn't lose a job. So do you guys have any responses to that on the stigma of homelessness and how that might be perhaps covering up some of the issues that are there?
Yes, definitely. Just to start, I think the stigma is a very is very big, but not only is there a stigma, just even in the general definition of the word homeless. Again, I'm not sure what the case is in the US, but in the UK, they only count people who are rough sleepers as homeless. So therefore, the example that was posted in the chat, this person wouldn't be counted as homeless. So I think not only is there a stigma, but also people don't understand what homeless means. And because there isn't a standard definition, that also adds to tackling this problem and then also trying to identify what some of the issues are surrounding water insecurity, because there isn't that formal definition or a definition that encompasses the various forms of homelessness. But if anyone would like to add on.
I guess I'll chime in. I think in the US, just from learning from the Housing and Urban Development Department in the federal government, is that those definitions of homelessness, chronic versus unsheltered versus sheltered, are all operationalized terms that are utilized by service providers for funding purposes. And that's all kind of like a common speak that people use. And so that, yeah, your ability to access certain services is probably reliant upon where you fall into that, whether you're willing to admit that you're part of one of those categories. And I think just from personal experience, yeah, if you are a working person who is living in their car and you go to school, what are you going to do in terms of maintaining your dignity? You have to put an incredible amount of time, resources to thinking about, do I get, a YMCA membership so I can have reliable water, or do I burden another friend? Like, you have to think about that on a daily basis of how that's going to work. So I think stigma is a really important aspect. And also in the public eye, what is homelessness is definitely construed as chronic. The folks with, particularly deep challenges of mental health or addictions, and also have been living unsheltered for long periods of time.
I think to that.
Okay. Oh, sorry.
I think briefly to add to that, people who live in vehicles remain heavily undercounted. And so I think it's not well studied, the stigma that people who live in vehicles may experience. And I think that's a potential research project for anyone to follow, because it's really important. I know in LA they have safe parking programs where it allows people living in vehicles to overnight, have a safe spot to sleep in their vehicles with security guard and access to a toilet overnight. And I think those programs have been very fantastic to address the need of people who are living in vehicles, because homeless count reports don't really account for that very well. And so I think it's a very important point.
Absolutely.
Yep.
Thank you. Oh, go ahead, Fausto.
Thank you. Just as an extra point, as I mentioned earlier, the homelessness literature speaks of that, of the construction of an identity of alienation, of stigma, shame, rejection, and that population that perceive themselves deserving can push the agenda and use it as a mechanism to punish this type of population, the homelessness. And the strongest interest groups have not only resources but organizational skills that these groups do not. And when groups live that, this punish, self-perception ends in auto-exclusion. So yeah, just an extra comment.
Wonderful, thank you. So for everybody attending, we're at the 1 hour mark. So if anybody needs to go, obviously, please feel free, come and go as you need to. We'll continue. I have one other question that I think is, we're at a really good transition point for that question right now. So the prompt that I had was, what are the key theoretical or analytical frameworks that are necessary for thinking through research on the intersection of water insecurity and homelessness or housing insecurity? So now that we've talked about kind of what we know, what we don't know, and what are some key pitfalls and ethical issues, how can we move forward? What are the frameworks and analytical tools that we need to move this research agenda forward? And I'll say that Katie Meehan has already started out with a comment here saying, brilliant points made by you all. Two things I'd like to add. As a group of water-oriented scholars, I think that we need to learn more from the housing RCN on critical housing scholars. So one would be this kind of critical approaches to housing is an analytical framework that we need to be thinking through. So I'll put that question to you guys and the panelists along with Katie's comment to see what you all think. And I know we have some more comments further down from attendees on this as well that we'll get to. So would anybody like to talk about that, about these key analytical theoretical frameworks that we need to think of moving forward?
Yeah, but especially with the water focus. Yeah, because for this approach, I have two ideas of what it is possible to contribute, and they are punctual. First, just as I mentioned it, would seem very important to me to talk about how developing an identity of belonging to the streets and a sense of community with more people who share this situation can mitigate some vulnerabilities, such as the access to water. um, in the other hand, I don't want to get into a predicament and if it exists, be in the middle of a debate. But from the experience shared with my advisor, Dr. Pacheco Vega, I know that there are water scholars who have an endless battle with bottled water. And so I think that a good research question would be that how should the fact that bottled water is a common source of water that plays a role as both a driver for and inhibitor of water access be resolved. So yeah, that's what I want to say.
Would anybody else like to jump in on this? I'll just, while you guys may be thinking or whatever, I'll read some other comments that have come from attendees that are about this. So Ellis said, and I think this is a really great comment, I think that one relationship or aspect that's been missing in the discussion is how water insecurity actually drives homelessness. I've heard Katie talk about that briefly at the workshop in Vancouver. So that was the workshop that led to the paper on household water insecurity in the global north. In Atlanta, people become homeless after years of struggle to pay their water bills. In the global south, broadly where I work, landlords easily evict tenants for failing to pay their water bills. I think those are very interesting but disturbing connections not explored enough in the literature. So does anybody have thoughts or comments, responses to that?
That's a really good question. I didn't explore that actually in my own research, and usually when they talk about water bills, they don't really address whether that contributes to people entering homelessness. But I mean, I think for future research, we should definitely be digging deeper on that question. I know that evictions, even as a result of the pandemic, have somewhat increased in some parts of the US. and that has driven the rate of homelessness even higher. And we didn't know exactly because they're not doing a homeless count this year, at least in LA, but I think that's a really good question, and I'm sorry I don't have an answer to it, but I know only able to pay rent, it's a driver to homelessness. Mental health problems, it's one of the drivers of prolongation of homelessness. But only able to pay water bills, I have not heard that, and I wish I would have asked that in my research, so thank you for bringing that up.
Yeah, there's quite some disturbing statistics have come out of California of I believe, if Greg Pierce is still on here, he can correct me, but I believe it's billions of dollars are owed by Californians in water bills that have racked up because California has instituted a moratorium on water shutoffs due to the pandemic. But basically, even though people can't be evicted for not paying their water bills, the water bills are still accruing debt. And so what is going to happen when this moratorium comes to an end and people are now owe this debt for their water bills is basically a looming crisis that's happening in California right now as the cost of water is increasing. And is very expensive. And so I think that this is an issue not unique to California, but in a lot of places. So it's a really important point that Ellis brings up. The other thing that is in the literature a little bit, kind of implied again in that Demeyers-Waprinski-Woodich article, is how stigma relates to this as well, right? So when people don't have access to water for sanitation, and are not able to clean their clothes and appear, quote unquote professional, that leads to further job loss, not being able to get a job, which has these cascading effects on losing access to housing and not being able to get the work that you need to secure your housing. So I think that relationship between water insecurity and housing insecurity and how water insecurity drives housing insecurity is really, really important. All right, so Amanda says, just a comment, no real question to panelists. Thanks for raising the issue of mental health and how it intersects with homelessness, which hasn't been talked a lot about today, but in my opinion is a super critical part of the heterogeneity of the unhoused population we've talked about. What, if any, discussion of that intersection exists within the psychology mental health service provision scholarship? Do any of you have a response to that? I think that's an area, I think that's a great comment, Amanda. And I think that as we move forward on this research agenda, that would be a key literature to look at. I myself don't have expertise in that literature, but I think that that's something that we would, as a group of scholars, both the critical housing literature and this psychology mental health service provision literature are really important literatures to be engaging with. So thank you for that comment. All right, any other comments or questions on the topic of analytical frameworks or theoretical constructs that we need to be aware of as we move forward with this research agenda, or on ethical issues? We're rounding out kind of our time here. So I'll just kind of open it up for general questions that people may have. We do have some exciting discussions going on in the chat here about potentially organizing an AAG panel to push these conversations forward, especially with the intersection of critical housing. So thank you to Raul and Katie and Wendy for talking about that. So that would be awesome. I think that all of you on the panel here have had such incredible contributions and inspiring ideas for how we all can move forward as a group of scholars. So I personally am really excited to continue these conversations with all of you and all of the attendees that we have here who are interested in working on this topic. So for anybody who would like to stay in touch about this, please go ahead and email me and I can kind of facilitate, whoever you need to get in touch with, or you can email Wendy or Lauren with HWISE, whoever you feel most comfortable with being in touch with. Raoul says, beyond the brilliance of all panelists, the fact that they are emerging scholars and rising stars is extremely inspiring. And that is so true. I think that the work that you are all doing is so inspirational and so important. So thank you for leading the charge and leading our panel today. All right, so I think that kind of concludes everything that we had to say. I'll hang back if anybody wants to chat. And